All right, welcome back. And we were talking about hantavirus right before the break. And we were looking at some slides regarding some of the information I was able to pick up and write down on a slide, which sometimes helps the viewers to get a picture of what we're dealing with. Let's go back to that first slide. And so again, remember that this is not named after, the hantavirus is named after the Hantan River in South Korea, which, by the way, which we'll talk about maybe on the next show about the MERS. I don't think we have enough time today to get to MERS. But South Korea is in the midst of an outbreak of MERS, where apparently about 100 people have been infected, and they're hoping to contain it, but it hasn't been contained as of yet. But anyway, so let's go to the next slide. And the hemorrhagic fever syndrome is a group of hantaviruses, and I mean, I don't know that you really need to know that information, but that's the genera family of the viruses that come out. This is the one that basically, I think, came up in hemorrhagic fever. This is the one that came up in Utah, I believe. And the one that came up in Yosemite recently was the pulmonary syndrome. And the hemorrhagic fever is very interesting because it actually can coagulate the blood, or it can go into what they call a DIC, where you basically bleed out. And the incubation period can be 2 to 4 weeks in humans before symptoms are basically found out. But here's the key to all this: is just that the practitioner or the people where you go, if you happen to be cleaning and coming in contact with mice, or you're bitten by a rodent in the Southwest, where it seems to be very, very prevalent, then I think that is of concern. So if you're in these areas where these primitive areas where mice are a problem, where you see a lot of mice droppings, things of that nature, it's very important that you stay away from the feces and all the other stuff. And if you're going to clean them up, or you have to clean them up, you might want to think about an N95 mask, something very tiny, maybe even protecting some of your eyes, or spraying Clorox, which is heavy-duty Clorox, which is very useful in destroying viral material. Ultraviolet lights can also be very, very important in destroying ultraviolet, but it's the aerosolation of the virus particles that you inhale, which is where people can get that particular exposure. I think we have another slide on and I guess the pulmonary syndrome is found North, Central, South America, and it's often fatal. I mean, that's one of the things. And in the United States, this is the Sin Nombre virus, called by the deer mice. I don't know much about deer mice, but it may be something that's isolated in that. And it starts out like any flu, symptoms such as a cough, which is a fever, headache, lethargy, and a sudden onset of shortness of breath with rapidly evolving pulmonary edema, that's fluid in your lungs, and often fatal despite mechanical ventilation and intervention with diuretics, maybe, and a fatality rate of 36%. Well, that's pretty significant, but the virus really doesn't come out that much. It's a very isolated area, so that's why they don't put much effort into developing some type of vaccine to that. But along that line, MERS also has a 39% mortality rate, but it can be and is often infectious from person to person. So it's very important when you have these RNA viruses are extremely dangerous viruses and extremely fatal. Ebola, again, almost 100% in some of these, and it's an RNA virus. One of the things that tends to predict the the outcome of these viruses are people that are sick, people that are elderly. So if you have some concomitant illnesses or you're not doing well and you get infected by some of these viruses, then you are basically going to succumb to those illnesses. So one of the things that's very interesting in learning about some of these viruses is that now they used to have the testing for viruses and where they are and when they come up has now gotten so sophisticated that they can map the DNA or the RNA of the virus and actually get an idea of when this virus entered the human population, when this virus, because every time a virus has a host and it replicates, it might actually pick up and take some of that DNA with it. And when it does so, it changes the virus structure to some degree, and they can actually map that and determine when that particular virus came in to the population. As they've done with the MERS virus, they can actually go back and look at it and see that it actually entered the human population around 2011, maybe sooner. And in all of these viruses, except for the hantavirus, bats seem to be the common vector. It certainly is that way in Ebola and Marburg virus, which is Marburg virus is a similar filovirus, which is a hair-like virus of the of that particular family, and the bats seem to be a vector in that particular virus as well. And they were a vector in the SARS virus, but they are not a vector in the hantavirus. And one of the things that's very interesting about the MERS virus is that it doesn't infect mice or rats, and therefore that makes it difficult for research. So these little bitty nuances of these particular virus particles, and it kind of makes sense. It's kind of a War of the Worlds type situation. You know, we've grown up and lived with these particular viruses, but this idea of a pandemic is very real because according to the information I received, there are 5,000 people a day that come to the United States from the Saudi Arabian Peninsula, where MERS is very common. And so that's a chance. And apparently there have been 2 cases of MERS found in the United States. And its incubation period is also about 5 days. So that being said, I mean, someone can get on a plane and then they can become sick and they can come to the emergency room and with this acute shortness of breath and these symptoms, and it's up to the ER doctors and the people that see these people to get a good history, know where this patient's been. Traveling is one of the things that's extremely important today because so many people travel all over the world. And we live in a hotbed in that area. I mean, we really do. I mean, how many people come to the city of Las Vegas day in and day out? And, you know, I used to laugh at some of the people that I see running around with masks on, but maybe they're not so, maybe it's not so silly after all, considering that we have people coughing and sneezing all over the place. So back to the hantavirus, it is very important that you prevent any possible exposure to that virus by basically limiting the exposure to the rodents. Having a cat was listed as one of the, so for those people that have cats, I mean, cats carry other diseases, don't get me wrong, but they certainly hold down the mice population. So one of the way you could deal with the potential for hantavirus, and it can even come up in this particular area. It is in the areas. I think when I read up the previous slide with the Sin Nombre virus, it was actually called the Four Corners virus, but they actually changed that, and you can see that in the bottom slide because there were people, the Native Americans, that kind of did not want that. So in 1993 was the first outbreak in the Four Corners region. And again, this is potentially fatal. However, with this particular virus, if you can connect with it early and you know that's what you're dealing with, sometimes supportive measures can avert that. I think there's one more slide on that where it talks about, no known antiviral treatment, and they won't because it comes up and then it goes away. Admitted to the hospital, given oxygen, and being treated very early and recognizing that's what you have can sometimes help to alleviate death due to that. And disposing of rodent nests, sealing cracks, holes in homes where mice and rats could get in and setting traps, laying down poisons, and using other natural predators such as cats will basically eliminate your mouse problem and then your risk for obtaining the hantavirus. So, and if you happen to go into an old house where there's a lot of mice feces, I would suggest that you think about spraying the area with Clorox and using a very protective suit to protect the aerosolization of that particular virus. It's very important to realize that that's how these things get transmitted into the air. So spray it down with Clorox, use ultraviolet radiation, whatever you need to do to try and limit your exposure to fecal material. And don't believe that just because the virus is dry, that the virus may be dry. I think it's very important to make sure that you put something on there to eliminate or destroy the virus capsules. I don't think they live in spores where they can live for years, such as anthrax and things of that nature. But it is very important for you to practice good precautions. And we're almost out of time. We're going to talk about MERS on one of the next show. I'll have a little more information on that for you. And I thank always Ray for calling in. He always has very interesting questions. And please feel free to call in. I get a lot of comments that people do watch the show, but usually are afraid to call in. And with that, I want to say thank you very much for letting me come into your home tonight to talk about different topics. And remember, one of the things I tell my patients all the time, walk after you eat. It's very important to prevent fat, obesity, and diabetes. And until then, I'll see you next week. Thank you.